Well, for every woman who hears those words, "you're pregnant," it's safe to say they want to deliver a healthy baby, but getting to that point starts before the baby is even born.
Unfortunately, many women do not have healthy pregnancies because they're addicted to drugs. Studies show the number of babies born addicted to drugs, including prescription medication, has tripled in the last decade.
Wow. Now a handful of niche clinics are opening up to help drug-addicted moms get clean and deliver healthy babies.
I've thought about that before. I mean, how did I just spiral out of control so quickly?
New mother Maria, who asked us to conceal her identity, began shooting up Dilaudid, a prescription pain reliever, with her boyfriend.
I was lying, cheating, stealing. You know, how can I get what I need?
Paying for the drugs cost Maria her home. She tried rehab at a methadone clinic, but she became pregnant and lost the baby.
I was just really depressed, you know, and really sad.
Maria was one of the lucky ones. A doctor got her in Vanderbilt's drug dependency clinic for pregnant women and got her started on a drug called buprenorphine 2 years ago. This year, she had a healthy baby girl.
It's given me the opportunity to be a mom and, you know, do what I'm supposed to do.
Which is one of our big goals, is to keep moms and babies together.
But that doesn't always happen. One baby is born every hour in the U.S. addicted to opioids. Dr. Jessica Young says mothers run the risk of losing custody of their children when child services get involved.
In several states, there are bills being considered that would mandate jail time for these women.
That's why she says options like buprenorphine are critical. The drug blocks the brain's cravings for opioids, making it less addictive than methadone. Patients report feeling normal, not high. For Maria,
it's pretty much changed and saved my life.
and 38 states have fetal protection laws. This month, Tennessee became the first state to criminalize drug use during pregnancy if the baby is born addicted to drugs.
Prescription medication is nothing to take lightly. You just heard it's easy to get addicted. And that's why it's so important to take that medicine as you're supposed to.
But for whatever reason, many people just don't. That's where there's an organization on Delmarva that focuses on making sure patients appropriately take their medications. Joining us today to tell us more is Michaud, a member of the Patient Advisory Panel for the Pharmacy Quality Alliance. Ron, thanks for joining us this afternoon. So first of all, why it's really important for people to take their medication appropriately. Why is that? And tell us your story.
Yes, it is important to take drugs properly all of the time, the right dosage, and for the amount of time that the doctor prescribes them. I had a heart transplant 10 years ago, and with that comes taking a lot of medications,
right.
like my immunosuppressants. If I don't take my immunosuppressants properly, then my body will reject my heart, which is not good.
Not a good thing.
No. So people need to take their drugs properly so that they get the proper health outcomes that the doctor would like them to have.
Okay. And you travel the country talking to people about this very thing.
Yes, I do. I got involved in that several years ago.
Mm-hmm.
The first time I did that was the kickoff of a national medication adherence program sponsored by the National Consumer League. And that was in Washington, D.C. And I spoke there along with Regina Benjamin, who is the former Surgeon General of the United States. So it was
wow.
quite an
and
event.
That's her right there, right?
Yes, it is.
Okay.
Yes.
Well, you mentioned 10 years ago you had your transplant, and in fact, yesterday was the anniversary of that, and you had some tests, which is why your hand is bandaged today. Now, when all this progressed, you got involved with the Pharmacy Quality Alliance. What does the PQA do?
The PQA is a multi-stakeholder organization that takes a look at the entire prescription drug system in the United States and then develops performance measures all along that system and then reports those results. So for example, it starts with the doctor prescribing a medication, the pharmacy delivering the medication, the patient taking the medication, and then the health outcome at the end.
Okay.
And for example, the Centers for Medicare and Medicaid systems use those performance measures to rate pharmacies and also the companies that that deliver medications over mail.
Right.
Now, people not adhering to how they're supposed to take their prescriptions, you actually call this America's other drug problem.
Yeah, it's a big problem. There are about 133 million people in the United States that take medications for chronic disease, and only half of them take their medications properly, which costs the economy about $100 billion a year. Because those people have adverse effects when they don't take their medications. They end up back in the hospital, either in the emergency room or as an inpatient to take care of them and get them healthy again and put them back on the medications.
Why do you think people don't take their medicines properly?
Well, they don't understand why they need to take medications in some cases.
Right.
Some of them take a lot of medications, and so that they get confused
Right.
about when to take them. The cost of medications, some people don't even go out and buy the medications when they're prescribed. They don't like the side effects of the medications. They don't read the labels properly, so there's a lot of reasons.
And it can be dangerous. So how do you encourage people to take these medications properly?
Well, I also belong to another organization called Mended Hearts, and we have a local chapter here at Salisbury, and we visit patients at the Peninsula Regional Medical Center. We see the heart patients there. We're a heart patient support group. And so we talk to them about leading a healthy lifestyle, but we also emphasize to them that they need to take their medications properly so that they get the proper health outcomes and they get well and they stay well. And so we try to get them organized, and we show them these little things. This is a pill sorter. I use this one. I take 23 different pills a day.
Wow.
So it's very difficult to just have them sit there in bottles and make sure that I've taken one of every right medication. So
it's important.
It's very important.
Stick to it.
Ron, thank you so much. Very, very important information.
Best wishes on everything with you.
Okay,
And
thank
if
you
you
very
would like
much.
to read more about the Pharmacy Quality Alliance, go to WBOC.com and click on our picture at the top of the page.
Okay, so we're talking about addiction. It's what a lot of combat war veterans face as they struggle to adjust to civilian life. Well, still ahead on Delmarva Life, although help is available for those men and women, they can still find themselves falling through the cracks. We're going to hear the story of how one man is trying to change that.
And later, a lot has changed over the years here at WBOC. 60 years on the air. WBOC's Steve Hammond joins us to preview a retrospective that airs tonight.
Oh, but wait, there's more. Steve's also joining us in the Delmarva Life kitchen to make today's retro recipe. Delmarva Life, we'll be right back.